Hello everyone, it's Dr. Manjiri Nadkarni, Ayurvedic MD, registered holistic nutritionist, live today from um, the Blue Water Nutrition page. I'm also live on Instagram that I'm holding in my hand because I just couldn't get the angle right. So today we are going to talk about polycystic ovarian syndrome, which is commonly known as PCOS, and we are also going to talk about the difference between PCOS and PCOD, which is the polycystic ovarian disease. And we're going to look at a few factors. We're going to talk about Ayurveda and what Ayurveda says about, these conditions. So I'm still trying to get the angles right. And that's why you can see my camera if I move it here. So if you have any questions, just feel free to post your questions here. I can see Vimarsha is online. Hi, Vimarsha. Thank you for watching live. If you are watching this live, feel free to post your questions below. If you are watching this as a replay, you can put a hashtag as replay and let me know. If you have any questions, I'll be more than happy to answer. So if you have been diagnosed with PCOS or PCOD, please feel free to reach out for more support. Ayurveda does have a lot of solutions, to help with hormonal health. So please feel free to reach out by scheduling a 15-minute consultation and we can discuss more about your condition. Hi, Shane. Nice to see you. Thanks for tuning in live. I can see quite a few people live on my Facebook page, and I can see quite a few people live on the Instagram as well. So that's good. So it is quite an interesting topic, and there are usually, a lot of confusion between the two. The one common thing between PCOS and PCOD is that, usually like fertility struggles could be, in both of these conditions, or when we talk about weight gain, when we talk about hair loss. So some symptoms can overlap, but one of these conditions is more severe than the other. One of these is more of like a metabolic condition, right? So that's what we're going to discuss today. And yeah, so let's get started. Just let me pull up my notes. Oops. Yeah. Right, and these are conditions that are also commonly affecting people, like they're extreme, I mean women. They're extremely um, common, and a lot has to do with the diet and lifestyle that we have now. When we talk about diet or when we talk about a poor lifestyle, it is causative in everything. So polycystic ovarian syndrome is more of a metabolic disorder, right? And polycystic ovarian syndrome, like, let's talk about it. So it is where your ovaries are actually producing higher levels of androgen, or the male hormone, than usual, right? And that can also interfere with the release and development of eggs or ovum, right? And these can develop into cysts or be cystic, and they're filled with a lot of liquid, and there's this buildup that happens, right? So PCOS is a serious condition. It is linked to insulin insensitivity, and it is also a metabolic disorder, and it can also pose as a risk factor for later on. You have chances of developing diabetes, you have chances of developing heart disease, because it is a metabolic condition, right? So when we talk about metabolic diseases or metabolic conditions, there's always one thing is going to lead into the other, right? And weight gain is extremely common with both, but this is mainly due to insulin resistance. So your cells are not receptive to your sugar balancing hormone or insulin, and that is why, even though you have insulin, rather you might have high levels of insulin, but this insulin cannot act on the cells, or the receptors are not identifying it, and that's why you have abnormal levels of high sugar, which then creates a lot of issues in your body. So that is the one way, how the pathogenesis occurs. And when we talk about PCOS, there could be different factors which are dietary and lifestyle, which make it worse, but there could also be certain genetic factors. This is mainly like an endocrine condition, so there are also different hormonal imbalances that can occur as well later on too. right? And PCOD is which is more a hormonal condition. PCOD is easier to treat, and the hormones are much easier to balance than the PCOS, right? So when we talk about polycystic ovarian disease, it is a condition where your ovaries are, releasing lots of immature or premature like eggs, and that can also turn into cysts. Now, there can be abdominal weight gain. So obesity is again a common factor. Irregular periods are common. Male pattern hair loss, you could be losing hair from the front part. Infertility is also very common. So these are some, signs that occur in the condition called PCOD. And irregular periods are, often how it's diagnosed. So if, young girls or women, when they miss their period, that's when it's diagnosed. And a lot of the times PCOD, when you can change your diet and lifestyle, it becomes very easy to reverse, right? So that is something where it's highly treatable. And there are also higher chances of conception with PCOD. So there is no permanent infertility. Sometimes PCOS can lead to infertility permanently, but PCOD, there are a lot more better results with dietary and lifestyle changes. And with PCOS, even hirsutism, because of the higher levels of testosterone, you can see a lot of, male pattern baldness is one thing, but hirsutism is more about growth of hair on the chin area, upper lip, or even side locks. You can get really thick, coarse hair. And those usually don't go away that easily. You have to kind of help with the condition, and that's when you don't get any new growth. Or hirsutism can stop, but you can't usually reverse what happens. Now, one of the other signs that can also be seen is dark discoloration. So if you're developing, there are some signs of insulin resistance in the body. So when we talk about weight gain, or a stubborn fat which you're not losing in spite of trying, that could also show that you do have, some kind of insulin sensitivity. That could be a sign that, you, especially belly fat, when we talk about that stubborn belly fat, that could be one sign. One common sign is, your neck region. If there's a dark discoloration around your neck, that could be one sign that you have insulin resistance. And also skin tags. So suddenly, if you're developing a lot of skin tags around your neck region or in the armpits, that also signifies insulin resistance, right? So these are a few things I wanted to draw your light to. So these are both slightly different conditions. PCOS is more metabolic, right? And PCOD is more of a hormonal condition. And both can be managed well by changing the diet and lifestyle, right? PCOS, you can't completely reverse it, right? But you can manage it. And PCOD has a lot more chances of treatment by changing the diet and lifestyle. So these are two common things. So now let's talk about Ayurveda and what Ayurveda talks about when we discuss, PCOS or PCOD. So if you look at Ayurvedic um, diagnostics, or Ayurvedic doshas, a lot of this can be understood as amajanya, right? Or it can also be understood as excess kapha imbalance. And usually it is also seen in kapha type women who are having a poor diet and lifestyle. So the kapha can get completely out of balance. That can create a lot of blockages. And that is why this ama or ama mixed with kapha makes your body insensitive to the insulin molecules. Okay, so Sarah is unsure which I have understood. So Sarah, I cannot like diagnose you, right? So you can connect with me and we can definitely talk more about it. So sometimes with PCOS also miscarriages are common, Sometimes there could also exist other conditions like thyroid imbalances. I've also seen to coexist along with PCOS, right? But I'm quite unsure of your question to me. So um, feel free to get in touch with me. We can always set up like a 15-minute talk, and if you have any questions for me, I'll be more than happy to answer. So feel free to reach out. You can even PM me, and I can, because I'm not sure what your question is. So you have to understand the differences between the two. You can connect with your doctor if you've already been diagnosed with a condition. Always getting hormonal profiles done is a good way to go about it. I can order salivary hormonal testing, so we can definitely do that in the clinic, but I'll need more information to understand what's going on, right? So when we talk about Ayurveda, it is usually a kapha imbalance in the entire body. There is also issues with vata getting out of balance. Even with a diagnosis of PCOS or PCOD, the presentations are going to be very different sometimes in different people, right? So one might have more issues with irregular menstruation, one might have more issues with weight gain. Certain people have a lot more signs of facial hair or hirsutism. So even the hormones are going to be in different ratios. So those are a few things we will have to first understand and work with, and then changing the diet and lifestyle. And even with insulin insensitivity, the first thing that we have to work with is taking all the refined products, refined sugars out. And I always come here and I always talk about sugar and its impact, right? So it's the like sugar has more of an impact on your overall cells. Like refined sugar is what I'm talking about, and it can worsen any existing conditions as well. So when we talk about metabolic conditions, when we talk about diabetes, when we talk about obesity, when we talk about any heart disease, white sugar or refined sugar has the potential of worsening all those and increasing your blood sugar levels, increasing the insulin resistance as well. So everything starts with cleaning your diet and cleaning your lifestyle, and lifestyle remedies are also important. So stress is another factor which we talk about. Not exercising, lack of exercise is another factor. So in Ayurveda, when we talk about ama, right, there is this gunky substance that's not getting digested, that's not getting eliminated or excreted out of your body, and that's not even getting absorbed, right? And it keeps circulating in your entire body. There are different remedies to be done, include to help with this ama. You have to digest or do ama pachana, which can be done through fasting or different kinds of fasting, or even exercising in the right way, the right kind of diet. Bitter herbs are fantastic, right? And there are also lots of options for insulin insensitivity. So that's something I just wanted to. So Vimarsha, that's a very good question. So a lot of the time, I get asked one question very commonly that you're asking me. So thank you for the question. So Vimarsha is asking me if jaggery can be replaced with refined sugar. So on one hand, 100% jaggery is way better than refined sugar, right? But if you are having issues with insulin, if you are having insulin insensitivity, anything that is creating this surge in the blood sugar, whether it's coconut sugar is even better because it's way lower in glycemic index, but even jaggery has the potential of increasing your blood sugar. So I've seen a lot of people, they'll replace the sugar they put in the tea with jaggery. If your insulin mechanism is working fine, that is a really healthy choice for you. But if your insulin is not working well, or if you have insulin insensitivity, if you have been diagnosed with either PCOS or PCOD, I would try to cut out refined sugar or any foods that have higher glycemic index, that have the potential of increasing your blood sugar, because your insulin apparatus is already not working well. So jaggery, you can have it. I don't prefer it in milk. Some people add it to tea, like the payasam. I like one of my favorite recipes is payasam, where you can use it with coconut milk. But ideally, if the question is in regards to PCOS or PCOD, ideally cutting down sugary foods would be a really good way to go. Again, trying to have protein at each meal is something I talk about a lot, and that is one way to balance your blood sugars, right? And if you have insulin insensitivity, balancing your blood sugar by having protein at each meal is extremely important. But when it comes to insulin resistance, you have to figure out what is causing this resistance in the body, right? And for people, like in Ayurveda, we talk about a concept called Sukha Sadhya. So if a condition is less than a year old, you can talk about reversing certain things pretty easily. The chronic the condition gets, the more time it's going to take for your body to heal. So ideally start by cleaning your diet. Ideally start by getting rid of foods that are harming you, creating inflammation in you, raising your blood sugar, or throwing your body out of balance, right? Start adding simple exercises, simple activities, something that you enjoy. um, Starting simple stress management tools which everybody needs today. So I know I'm talking about a lot of general things, but simple things matter a lot. I've seen a lot of simple things to be way more effective in my practice of the past 5 years, in helping people, but they have to be more consistent, right? So whether it is PCOS, whether it is PCOD, the one thing that 100% helps is cleaning up your diet as well as your lifestyle. And that is kind of the need of the hour, right? And then definitely you can get more help. We can understand with the hormonal profiling as to what hormones are out of balance and how we can bring those back in balance, right? I've also seen that when your female hormones are out of balance, sometimes your thyroid is out of balance along with it, or your adrenals can get out of balance as well. So we need to really figure out what exactly is causing this imbalance, and then we can kind of support you as well. So if you have any more questions, please feel free to ask any questions that you have, or reach out if you need more support. And if you know somebody that has either PCOS or PCOD, feel free to share this video with them, and I'll be more than happy to talk to them about how we can help them, right? So thank you for watching. This is a shorter video. I will be back next week on the Wellness Wednesday. I will be resuming the Facebook 100 Days of Ayurveda. I took a little bit of a break because of some personal stuff going on, the clinic being busy, as well as some crazy things happening. So I will be back next week onwards, and I'll start posting those, so ahead of time. Stress plays a huge role in insulin as well, right? So in insulin resistance, if you stress, so that's a very good question, Shane. So stress does play an important role in both, and also insulin resistance. So that is how it can impact. And you will also see lots of clients. I believe you're an Ayurvedic doctor as well, so you'll also see lots of clients where they're taking control of the diet, but the stress factor is totally out of balance, right? So you have to be able to balance that as well. So thank you for watching, and if you have any questions, please feel free to reach out, and I will connect with you next week, Wednesday, for another Wellness Wednesday. Thanks and have a good day. Bye for now.